Causes of lower back pain and common risk factors. According to the National Institute of Neurological Disorder and Stroke, the vast majority of low back pain is mechanical in nature. In many cases, low back pain is associated with spondylosis, a term that refers to the general degeneration of the spine associated with normal wear and tear that occurs in the joints, discs, and bones of the spine as people get older. Some examples of mechanical causes of low back pain include: sprains and strains account for most acute back pain. Sprains are caused by overstretching or tearing ligaments, and strains are tears in tendon or muscle. Both can occur from twisting or lifting something improperly, lifting something too heavy, or overstretching. Such movements may also trigger spasms in back muscles, which can also be painful. Intervertebral disc degeneration is one of the most common mechanical causes of low back pain, and it occurs when the usually rubbery discs lose integrity as a normal process of aging. In a healthy back, intervertebral discs provide height and allow bending, flexion, and torsion of the lower back. As the discs deteriorate, they lose their cushioning ability. Herniated or ruptured discs can occur when the intervertebral discs become compressed and bulge outward, herniation, or rupture, causing low back pain. Radiculopathy is a condition caused by compression, inflammation and injury to a spinal nerve root. Pressure on the nerve root results in pain, numbness, or a tingling sensation that travels or radiates to other areas of the body that are served by that nerve. Radiculopathy may occur when spinal stenosis or a herniated or ruptured disc compresses the nerve root. Sciatica is a form of radiculopathy caused by compression of the sciatic nerve, the large nerve that travels through the buttocks and extends down the back of the leg. This compression causes shock-like or burning low back pain combined with pain through the buttocks and down one leg, occasionally reaching the foot. In the most extreme cases, when the nerve is pinched between the disc and the adjacent bone, the symptoms may involve not only pain, but numbness and muscle weakness in the leg because of interrupted nerve signaling. The condition may also be caused by a tumor or cyst that presses on the sciatic nerve or its roots. Spondylolisthesis is a condition in which a vertebra of the lower spine slips out of place, pinching the nerves exiting the spinal column. A traumatic injury, such as from playing sports, car accidents, or a fall can injure tendons, ligaments or muscle resulting in low back pain. Traumatic injury may also cause the spine to become overly compressed, which in turn can cause an intervertebral disc to rupture or herniate, exerting pressure on any of the nerves rooted to the spinal cord. When spinal nerves become compressed and irritated, back pain and sciatica may result. Spinal stenosis is a narrowing of the spinal column that puts pressure on the spinal cord and nerves that can cause pain or numbness with walking and over time leads to leg weakness and sensory loss. Skeletal irregularities include scoliosis, a curvature of the spine that does not usually cause pain until middle age, lordosis, an abnormally accentuated arch in the lower back, and other congenital anomalies of the spine. Low back pain is rarely related to serious underlying conditions, but when these conditions do occur, they require immediate medical attention. Serious underlying conditions include: infections are not a common cause of back pain. However, infections can cause pain when they involve the vertebrae, a condition called osteomyelitis, the intervertebral discs, called discitis, or the sacroiliac joints connecting the lower spine to the pelvis, called sacroiliitis. Tumors are a relatively rare cause of back pain. Occasionally, tumors begin in the back, but more often they appear in the back as a result of cancer that has spread from elsewhere in the body. Cauda equina syndrome is a serious but rare complication of a ruptured disc. It occurs when disc material is pushed into the spinal canal and compresses the bundle of lumbar and sacral nerve roots, causing loss of bladder and bowel control. Permanent neurological damage may result if this syndrome is left untreated. Abdominal aortic aneurysms occur when the large blood vessel that supplies blood to the abdomen, pelvis, and legs becomes abnormally enlarged. Back pain can be a sign that the aneurysm is becoming larger and that the risk of rupture should be assessed. Kidney stones can cause sharp pain in the lower back, usually on one side. Other underlying conditions that predispose people to low back pain include inflammatory diseases of the joints such as arthritis, including osteoarthritis and rheumatoid arthritis, as well as spondylitis, and inflammation of the vertebrae, can also cause low back pain. Spondylitis is also called spondyloarthritis or spondyloarthropathy. Osteoporosis is a metabolic bone disease marked by a progressive decrease in bone density and strength, which can lead to painful fractures of the vertebrae. Endometriosis is the buildup of uterine tissue in places outside the uterus. Fibromyalgia, a chronic pain syndrome involving widespread muscle pain and fatigue. What are the risk factors for developing low back pain? Beyond underlying diseases, certain other risk factors may elevate one's risk for low back pain, including age. The first attack of low back pain typically occurs between the ages of 30 and 50, and back pain becomes more common with advancing age. As people grow older, loss of bone strength from osteoporosis can lead to fractures, and at the same time, muscle elasticity and tone decrease. The intervertebral discs begin to lose fluid and flexibility with age, which decreases their ability to cushion the vertebrae. The risk of spinal stenosis also increases with age. Fitness level. Back pain is more common among people who are not physically fit. Weak back and abdominal muscles may not properly support the spine. Weekend warriors, people who go out and exercise a lot after being inactive all week, are more likely to suffer painful back injuries than people who make moderate physical activity a daily habit. Studies show that low-impact aerobic exercise is beneficial for the maintaining the integrity of intervertebral discs. Pregnancy is commonly accompanied by low back pain, which results from pelvic changes and alterations in weight loading. Back symptoms almost always resolve postpartum. Weight gain. Being overweight, obese, or quickly gaining significant amounts of weight can put stress on the back and lead to low back pain. Genetics. Some causes of back pain, such as ankylosing spondylitis, a form of arthritis that involves fusion of the spinal joints leading to some immobility of the spine, have a genetic component. Occupational risk factors. Having a job that requires heavy lifting, pushing, or pulling, particularly when it involves twisting or vibrating the spine, can lead to injury and back pain. An inactive job or a desk job may also lead to or contribute to pain, especially if you have poor posture or sit all day in a chair with inadequate back support. Mental health factors. Pre-existing mental health issues such as anxiety and depression can influence how closely one focuses on their pain as well as their perception of its severity. Pain that becomes chronic also can contribute to the development of such psychological factors. Stress can affect the body in numerous ways, including causing muscle tension. Backpack overload in children. Low back pain unrelated to injury or other known cause is unusual in preteen children. However, a backpack overloaded with school books and supplies can strain the back and cause muscle fatigue. The American Academy of Orthopedic Surgeons recommends that a child's backpack should weigh no more than 15 to 20% of the child's body weight. If you love this video, please like and share your opinion in the comment box below. Don't forget to click the subscribe button below for more research-based home remedies, natural health and beauty tips.